There we go. Great. Again, thank you so much for joining us today for February's Transition Stakeholder Advisory Council meeting. Just a couple housekeeping things to go over before we get started. As you just heard, I am recording this meeting, so please refrain from sharing any personal or protected health information, either verbally or in the chat. We will be using the chat panel to manage questions, and so please click the chat button at the bottom of your screen to type those in as you have them. We will respond to questions periodically as they come in, and then also at the end of our time. You may click the closed captioning or CC button at the bottom of your screen to turn closed captioning on or off. And lastly, at this time, the department is not allowing external use of AI note-taking bots in our meetings without an advance accommodations request. If this is an accommodation that you need, feel free to email John Barry, whose email address is listed on this screen, and he can assist you. Before we get started, I want to highlight the mission here at the Department of Healthcare Policy and Financing, which is to improve healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. And here at the department, we administer Health First Colorado, which is Colorado's Medicaid program, and Child Health Plan Plus, and other healthcare programs for Coloradans who qualify. I'm really excited about our agenda for today. We have a couple of great speakers who are here to share some important information with you. First, we will hear from Consumer Direct Care Network Colorado, or the acronym CDCO. We'll hear from, I'm sorry, I actually meant to include other people's names. So sorry. We'll hear from Adele Castillo, Kathy Sanders, and Chelsea Barraza. I'm sorry that those other names aren't listed on here. I'll correct that momentarily. They are going to be sharing information about and answering questions on two consumer-directed programs, including in-home support services, which uses the acronym IHSS, as well as consumer-directed attendance support services, which uses the acronym CDAS. After that, we will hear from Carly Donahue-Torres. She works here at the Department of Healthcare Policy and Financing, and she has some important information about innovations concerning the Certified Community Behavioral Health Clinics, which also uses the acronym CCBHC. And then after that, we'll have a time for open discussion and questions. And so without further ado, I would like to welcome the team from CDCO.
Hi everyone, my name is Chelsea. I am the training lead here at CDCO. I've been here for about 5 months, so I'm pretty new. And before that, I was a lead over at an IHSS agency for a few years.
Everyone, my name is Adele. I'm the CDOS and IHSS liaison. So I come from the case management background. So I was doing that for about 2 years, and I've been with Consumer Direct for about 7 months now.
Kathy Sanders. I am our program director for CDCO. I started in October. Our team's really new. My background is also in case management, about 16 years worth. Had the pleasure of working with Amy, so.
All right, so we are going to, I'm just going to get started. So first, I just want to share what our values are with everyone. So our mission is to provide care and support to people in their homes and communities. Our vision is to help people live the life that they want, and our values are respect, integrity, service, and excellence. So some of the services we offer is we do member and authorized representative orientation and coaching. And we do offer these orientations and coachings in a variety of formats. Then we do ongoing support for CDOS and IHSS participants. So if anyone has any general questions regarding CDOS or IHSS, they are always more than welcome to call us. We also do IHSS agency training, so we provide that training to the IHSS agency providers. And then we do case management training, so we train the case managers on CDOS, IHSS, and so forth. And then we provide education and tools for recruiting, hiring, training, and managing attendance. And then we also have the information and assistance services, which we will talk a little bit more about towards the end of our presentation. So just a quick overview of IHSS and CDOS. They are participant-directed programs that are home and community-based services. So they assist members through task-based services and guiding their own care and maintaining their independence. So IHSS allows the members to direct and manage the caregivers who provide them personal care, homemaking, health maintenance services, with the added support of an agency. So through IHSS, members are empowered to select, train, manage the caregivers of their choice to fit their unique needs, or they may choose to delegate these responsibilities to an authorized representative. But again, they have that IHSS agency to provide them with support. Then we have CDOS, which allows the members to direct and manage the attendants who provide them with that personal care, homemaker, and health maintenance services. And then rather than working through an agency, the member or the authorized representative does that themselves. So through CDOS, members are empowered to hire, train, manage attendants of their choice to best fit their unique needs, or they may again delegate these responsibilities to an authorized representative. So here at CDCO, for both CDOS and IHSS, as the training and support contractor, we help people learn and plan their care. So we work with the financial management services, or the FMS contractors, the case managers, the IHSS agencies, and the Colorado Department of Healthcare Policy and Financing to help the eligible Health First Colorado members enroll in CDOS and IHSS programs. So first, we're going to go into a little bit more detail on in-home support services, or IHSS. So in IHSS, the members stay in their home and direct their care. So the members may choose to have a more active role in hiring and training, or they can delegate some of these tasks more so over to the agency. And the agency will provide 24-hour backup services. So if any of the caregivers have an emergency or are unable to attend their shift, the agency will make sure that the member is still taken care of. They also provide attendant benefits to those caregivers, and then they offer independent living core services as well as access to a nurse for the members. So in order for someone to have IHSS be their service delivery, they have to be on the following waiver. So we have the elderly, blind, and disabled waiver, or the EBD waiver, the complementary and integrative health waiver, which is previously the SCI waiver, and then we have the Children's Home and Community-Based Services, or HCBS waiver. And it is important to know that IHSS is not an option for those who are on the brain injury waiver or the community mental health supports waiver. So the steps to enroll in IHSS, the members must first enroll in an eligible waiver, and then in step 2, they meet with their case manager, and the case manager will assess the needs. In step 3, the member or authorized representative picks an IHSS agency that best serves that member's needs. And then in step 4, they enroll with that IHSS agency. In step 5, case managers will approve a care plan created by that agency, and they get a prior authorization request, or PAR, which allows that IHSS agency to bill. In step 6, the IHSS agency begins the staffing and the orientation of the member, AR, and the caregivers. And then in step 7, services can begin. Now for consumer-directed attendant support services, or CDOS, a member or AR will act as the employer of record. So now instead of the IHSS agency being that employer of record for the attendant, it is now the member or the AR. They also have a financial management service, or again, an FMS, and this company provides fiscal services, to support that employer. So they help with the payroll, the taxes, budgeting, tracking, etc. And then family members can be paid attendance. Family members in CDOS can be paid for homemaking, so that is different from IHSS. And members cannot have long-term home health together with CDOS. And the member NAR does have budgeting authority here. So they do get to choose how much to pay their attendance. And then the waivers eligible for CDOS are the brain injury waiver, BI, the community mental health support, so CMHS, the complementary and integrative health waiver, CIH, the elderly, blind, and disabled waiver, or EBD, and the supported living services, or SLS. So as you can see, there's a few more waivers that can access CDOS as their delivery option. And then in order for someone to enroll in CDOS, again, they must first enroll in an eligible waiver. In step 2, they will meet with their case manager who can assess their needs. In step 3, they have to attend training with us at CDCO. And then as part of our training, we do help members or their authorized representatives complete what we call the Attendance Support Management Plan, or ASMP for short. And this is where they create a plan on how they will manage their attendance and budget their monthly allocation. So they do that with our support in step 4. And then in step 5, that case manager will approve of that plan and they get a referral over to that financial management service. In step 6, the member enrolls with that financial management service, as well as the caregivers. And then in step 7, the FMS receives the prior authorization request, which again allows them to bill. And then in step 8, services can begin.
Okay, so next we're going to be talking about information and assistance. So this is a relatively new program that provides additional assistance to members and authorized representatives on IHSS and CDOS programs. So what are INA services? So these services help members or their authorized representatives manage their care when they desire or need extra help. These services provide support that matches each person's needs and preferences through a more hands-on relationship with an INA coordinator. The main purpose of INA is to help people receive the best services within CDOS and IHSS. This means giving them advice that fits their needs, sharing helpful information to learn more about self-directing, and offering support to make decisions easier. Okay, so how can INA assist members? So we have the following service categories that we can assist with. So we have Medicaid navigation, consumer direction education, support resource navigation, service quality reporting, member enrollment, emergency and backup planning, CDOS individual allocation utilization coaching and monitoring, attendant recruitment and retention, and also mediation services. Okay, so to request INA services, we have members, authorized representatives, those FMS providers, and also case managers that can submit a referral online through our website. And then we're just going to be wrapping up from here. So we're going to just move on to our contact information and then answer any questions anyone might have. Okay, so we kind of went through introductions at the beginning, but we have Kathy Sanders. She's our program director. Carly, she's not on the call today, but she's our information and assistance lead. Myself, Adele, I'm the CDOS and IHSS liaison. And then of course, Chelsea, our training lead. And then since we are contracted through the State Department, we have the participant-directed programs unit. So we have Erin Thatcher, she's the unit supervisor, Danielle Comstock, she's the programs lead, Amanda Smith, she's the policy advisor, and then Jessica Corral, the contract specialist. And they can be reached at 303-866-5638. And then they also have an email address, hicpuff_pdp@state.co.us. All right, and then of course you can always contact us at any time. We can be reached at 844-381-4433. And then our website also has a lot of great resources, all of our forms that are up to date, as well as training manuals, which is very helpful. And then we do have our general email address, which you can direct any questions, and we can always hop on and kind of answer those as well. So that email address is going to be info@cdco@consumerdirectcare.com. Right, so any questions at this time?
Wonderful. I'm not seeing any questions, and I don't think there were any in the chat unless I just missed them. But this is great information. I think there's a lot of value in these participant-directed programs, and we really appreciate you guys joining us to share some information. We'll give just another second in case someone has a question. All right. Seeing none, thank you all so much. You're welcome to hang out and learn about CCBHC from Carly, or you're welcome to hop off, whatever you prefer. Thanks so much, you guys.
All right, thank you, Amy. Thank you, everyone.
All right. And so Carly, I think I saw you on here. She, as I mentioned, she works here at the Department of Healthcare Policy and Financing and has some information to share about initiatives concerning the certified community behavioral health clinics. Carly, are you ready? Carly, are you ready to roll?
I am. Thanks so much, Amy.
Sure.
And thank you for having our little project on to share the word. I am Carly Donahue Torres. I am the Behavioral Health Alignment Analyst here at our Office of Behavioral Health Initiatives and Coverage within the Department of HICCUP. Phew, lots of words. We are starting up a project that revolves around certified community behavioral health clinics. So today I'm going to just walk this group through what is a certified community behavioral health clinic, what they're doing in Colorado, and what the state is getting up to with them. Starting off with Certified Community Behavioral Health Clinics, CCBHCs for short, are specially designated organizations that are designed to ensure access to coordinated, comprehensive behavioral health care in the community in which they're situated. The goal is that they will provide integrated, evidence-based, trauma-informed, recovery-oriented, and person-centered care. And at the end of the day, that means that we would expect a CCBHC, so a particular community health organization that is certified, to provide treatment to anyone who presents to them, regardless of where that person lives, regardless of that person's ability to pay for their services, regardless of that person's age, and that includes services for children and youth, older adults, veterans, and additional groups. Next slide, if you can, Amy. Thanks so much. To get into a little bit more details, CCBHCs are a federally recognized best practice model. That means that if to be certified by your state, a state program that will certify a CCBHC must ensure that those organizations follow a slew of very rigorous certification criteria. The CCBHCs are required to provide crisis services 24 hours a day. They are required to ensure comprehensive outpatient mental health and substance use services, person and family-centered treatment planning, as I mentioned, ensure community-based services for veterans. They're encouraged to include peer family support and counseling along with traditional peer services, targeted case management, and then are also required to complete certain primary care screenings and monitorings, just again in the spirit of ensuring folks are receiving all of the care they might need with as few stops as possible. They're also required to provide psychiatric rehabilitation services and screening diagnosis and risk assessment services. I won't read through all of our criteria program areas. As you see, we do have 6. And when I say we, I mean federal government. And CCBHCs must coordinate care between other behavioral health providers, physical health care providers, and other community resources and social service systems within their communities. And again, the spirit of the CCBHC is to create a space where folks can go to get their behavioral health care met, where they'll also be presented with the opportunity to have other folks help them coordinate that care and potentially coordinate with primary care or other specialist care as needed. As we know, there are a lot of folks who may have co-occurring conditions, comorbidities, and so on. And one of the goals of the CCBHC is to eliminate some confusion and frustration for members seeking those services. As I mentioned, the CCBHC model, oh, you can move on, Amy, that's fine. As I mentioned, the CCBHC model is federally administered through SAMHSA. And there are multiple ways a state or an organization can tap into SAMHSA resources to stand up the model either at the organizational level or at the state level. Colorado is participating in that state doorway. We have been awarded a 2025 CCBHC planning grant that will afford us $1 million grant over 1 calendar year. We were awarded that grant on December 31st, 2024, just a little over a month ago. And the clock runs out on that grant period on December 30th of this year, 2025. We will use this planning grant year to assess our current system and map how and what we need to change in order to potentially move into the CCBHC model in whatever ways might further support the growth and continuation of the comprehensive behavioral safety net that we've already built over the last few years. If you'd like to go to the next slide, Amy. So CCBHCs in Colorado, I just mentioned that we have that Colorado Behavioral Health Safety Net system in place. It's been designed and implemented over the last few years with the CCBHC model in mind. There are several several aspects that align, again, with the goal of creating a comprehensive, accessible behavioral health system within the state. One of the ways that that system is made sustainable is by implementing a prospective payment system, which Colorado has implemented for its comprehensive safety net providers. Colorado did also participate in the first planning grant round, and I apologize, there's a typo on my slide, it's distracting me. We actually participated in that first CCBHC planning grant back in 2016, and that was one of the first steps the state took in creating the safety net system, building the current PPS system, and setting up some of the licensing and regulations that it has in place for our safety net providers that were implemented just this last year. There are 7 providers in Colorado that are currently participating in the CCBHC expansion grant program. And that is a funding opportunity at an organizational level that allows clinics themselves to apply for and potentially receive a grant from SAMHSA that allows them within their own clinics to conduct community assessment needs and stand up any infrastructure they may need to rise to the level of expectation and performance that we ask CCBHCs to commit to. So all of this to say, we have quite the load in front of us this next year. It is, I want to reiterate, a planning year. We really want to take a look at what we've got in place here in Colorado, take a look at all the good work that is happening in various communities around our state, and really assess how we can support that. It may be that implementing a full CCBHC model that meets the requirements of the federal government, or SAMHSA, I should say, the federal administration, is the right move for Colorado, and we potentially will have the opportunity to engage with additional federal funding opportunities if we move forward. But we want to make sure folks are protected, that we aren't potentially threatening services and systems that are already in place, that we're thinking about provider administrative burden, and doing everything we can to not potentially hinder the services that folks already need and may be getting. All about trying to get better and increase access in whatever ways we can. If you'd like to go to the next slide, Amy. I also want to make everyone aware that we do have some engagement opportunities. We are in the process of seating a steering committee, which we hope to be diversely representative of various communities and priority populations within the state, as well as represent several different areas of subject matter expertise. So we're in process of collecting applications for that. We are holding a monthly CCBHC stakeholder forum that will be taking place every month. The purpose for which is to ensure anyone is able to come and receive updates and report outs from our staff and from our partners. You are able to register on the HICPF CCBHC website. And sorry, I lost my chat. I want to just pop that in the chat for folks. Additionally, on this website is more information about CCBHCs generally and the CCBHC model in Colorado. In case I talked a little too fast or threw a little bit too much information at you all at once, this is a resource we've set up for folks to read through and reach out if they do have any additional questions or clarifications. We will have other opportunities available on the website soon. We are building some of our stakeholder engagement infrastructure for our project. And we hope to continue hearing from community members and community advocates as we think about this model and how we can potentially implement it in a way that best supports our systems. And that's what I've got for you today.
Thank you so much, Carly. A lot of really exciting things happening in this space. Any questions from anyone? Carly, is there specific feedback right now that you are after? Any kind of targeted questions that you would have for this group regarding any of the pieces of feedback that you're specifically asking folks?
I wouldn't necessarily want to put anybody on the spot. We are hoping to set up a kind of just an open survey space through our website, so that as folks perhaps hear about this in various areas where you're doing any advocation work or community outreach, you can direct folks to ask the question, no question too small or too big. And we can really start thinking about how the CCBHC model can help us make connections. That I think is, as probably the folks on this call are aware, one of the areas we may have challenges in Colorado and where we can improve is connecting connecting members across different services and to the right service at the right time. And this is potentially a big step in the right direction for that. I think I may have seen, are there many clinics who have been certified thus far? Okay, and I appreciate that question so that I'm able to clarify. As I mentioned, we are currently in a planning year. And so that will include HICPF partnering with our colleagues at the Behavioral Health Administration to build what the certification process and criteria will be specifically for Colorado. If you head to the website I dropped, you'd actually be directed to the SAMHSA website, where they give their federal guidelines for CCBHCs must have A, B, C, D, and E. And Colorado then sits down and says, okay, how do we make sure our clinics have A, B, C, D, and E? And is there anything else we need to make sure they have for Coloradans and for the folks seeking care at their clinics? So that will be led, that's work led by the BHA so far as certification goes. So technically, because we do not have those in place, we have no clinics fully officially certified, but we have 7 sites who have applied for and received a separate funding opportunity through SAMHSA called the CCVHC Expansion Grant. And that is a bucket of money that goes to organizations for them to do staffing expansions, infrastructure expansions, to improve their electronic medical records, and to just do the work of doing really detailed community needs assessment to ensure that people they're serving have access to the services they need regarding behavioral health. I hope that that is helpful. Are there any clinics participating on the Western Slope? So I will tell you, kind of. We have the closest you're going to, I do believe there is a clinic that is in the process of, or they have already received the expansion grant in Durango. So depending on where you are on the Western Slope, kind of. A little more in the south, of course. I think we've got more coverage in the south than in the northern part of the Western Slope, but that's probably the closest clinic there. Yes. Access in Durango. It
And then
was.
Carly, I do see we have a hand up. Jen, do you want to go ahead and ask your questions or comment?
Yeah. Yeah, thank you. This sounds great. But if this is a planning year, how do you intend to spend $100 million grant?
So just 1 million. Just to
Oh, okay,
clarify.
thank you.
Yeah, absolutely. Man, what could we do with $100 million? That would be great. No. It is $1 million. What we are planning to do is actually put that money towards hiring a few folks with very specific subject matter expertise over a 9-month period, and also engage with several contractors who have very specific subject matter expertise. Um, and and unfortunately money kind of quickly runs out, particularly when it comes to things like actuarial services and accounting services, and then data systems and coding services, which is really what we're thinking of, like computing and investing in the infrastructure for the state to properly collect data on the BHA side as well. The grant is also being shared between HCPF and BHA. Might be a good clarifying point. So that's the high level overview of what we are spending that on. Man, I wish we had $100
Thank you.
million.
I know, right? I wish we all did.
Right. Everybody deserves $100 million to support their clinics. I think so personally, but we do what we can with what we must. Thank you for the question, though, to clarify some of those details.
Question. Great questions in the chat and verbalized. Anything else? Any other questions about what this means for you personally or the agencies you represent when it's all kind of done with the planning year? All right. Carly, thank you so much. This is great information, really exciting. I hope that folks take the opportunity to be involved with some of your stakeholder events or stakeholdering, because I think it sounds like it's going to be a great program.
Yeah, thank you again for allowing me to come and speak. Again, this is really just trying to get the project off the ground, get the word out to folks, so that we are able to get that feedback and that participation. We really, really value various perspectives folks have, especially in representing a lot of different groups. We really want to try to make sure those voices are heard.
Thank you so much.
Thank you.
And so now I think that if we want to kind of in general open up the floor as we usually do for any off-topic questions, points of discussion, always open to hear about future topics that you would like to hear about, learn about, speak about. We would love to hear about that. All right. Well, if anything comes up in the future, these are our program. Am I still sharing? I'm still sharing. These are our TSAC contacts: Matt Bohannon, Access Unit Manager, and Chanel Pugh, the InReach Unit Manager. Always open to hear feedback or ideas from you all. If there is nothing else, I guess we can end a little bit early. I'll stay on for just a little bit in case anyone has any walk-on items or walk-on questions that they would like to ask of the TSAC team. Thank you again to our guest presenters. It was really, really great to hear information from you all that can benefit all of us.
Hi, Amy. I just had a very quick question. I unfortunately had a scheduling conflict. I was intending to take part in this, but where will this be posted, the recording?
Question. We are working to, and I think other folks on this team, please correct me if I'm wrong. I think we're working to have them available on the Transition Stakeholder Advisory Council website. And I can find that link. I don't have it handy right now, but is that right? If someone can make sure I'm saying the right thing.
Is that going to be like an offshoot of the OCL stakeholder?
Yeah, I can send it to you, Bryce. We had a question about updating it. And so we're just making sure, because there were a couple videos that we were looking for, but we think we canceled on those meetings. So we're just confirming that we have all of the details before we get it updated. But yeah, let me find the link and I'll send it to you right now. Do you want me to email it or you want me to just drop it to you?
You can email it to me. I'll just put my email right here.
Okay. I think I have it. We met about
Yeah.
at risk. So
Just in case
oh,
that.
and Amy, do you want to stop the recording since we're kind of at the yeah.
I do if I can find how. There we go.
Okay. There's the yeah.